Hello everyone, myself Dr. Priyanka and I'm one of the mentors for StudyMRCPI. So we are doing OMR series which we discusses most important stations which come in OSCE exam. So today we'll be discussing an important patient simulated task on antenatal care module on the monochorionic twin pregnancy. So do like, share and subscribe and also press the bell button icon to get the recent updates on the recently added videos. So do remember that success is a journey and not a destination. So we will start the station about the multiple pregnancy. So hello, I'm Dr. Priyanka, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yeah, Priya, before we start, can I keep the timer so that we know that we are working on the time? Is that okay? And do you want to show the task also?
Yes.
So they can see and then we can start off? Okay. Yes.
Okay.
Yes. Shall I keep the timer?
Yes.
Yes, please, Priya. Yeah.
Hello, I'm Dr. Priyanka, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Hi, I'm Susie Jones and I'm 26-year-old.
So how would I like to call you?
Susie should be fine for me.
Nice to meet you, Susie. You can call me Priyanka.
Thank you.
Yeah. So, Susie, I can gather from your reports that you are pregnant and you had recently done a scan and you have come here to discuss the results of the report. Am I right?
Yeah, very true. Because I was really bothered by vomiting and they have done a scan, but I'm not sure what the reports are because the doctor wasn't very they said that you are the one who will be explaining me the reports.
Yes, definitely, Susie. In meanwhile, I will definitely explain you about the reports. But as we are meeting for the first time, can I ask you a few questions to know about you better?
Sure.
Okay. So Susie, as you said that you are quite disturbed because of the nausea feeling. So you want me to give you some medications for that?
No, I'm okay now because I haven't was in daycare twice and I was given the fluids and all that. I'm okay now. It is getting better and looks like I've lost some weight also, but that's fine. I'm okay. Thank you.
Okay. And any other problems that you are having, like any bleeding, spotting, or any other problems?
No.
Okay. So Susie, when was your last date of periods?
I know that my periods have been regular, so it is somewhere around 3 months before, but I do not remember the exact date.
Okay. So and also, was this a natural pregnancy or you had taken any medications?
No, actually, we have been married for 3 years and I was really worried about conceiving because we have been trying for a long. So, but this, thankfully, I conceived on my own. So I haven't taken any treatment so far.
So congratulations, Susie, for that.
Thank you.
So I can gather that this is your first pregnancy because you said you are trying for 3 years.
Yes.
So,
yes.
Okay. So any medical conditions you have, like any blood pressure or diabetes, any other problems?
No, I'm generally fit and fine.
Okay. Any surgeries you have on your tummy or down below?
No.
Okay. And are your cervical smears up to date? Like
yeah.
Okay.
I have got only one. Yes, that's normal.
Okay. And any family history of twin pregnancy?
Yeah, my sister had an identical twins and my aunt also had an identical twins. So that, why doctor, do I also have twins?
Yes, Susie, the report says that you are having the twin pregnancy. So
that's fantastic. Okay.
Congratulations again. So I will be coming to the report and explaining what the report actually is. Okay. Okay. And any family history of like any blood pressures or sugars, anything like that?
Yeah, actually, both my parents have this high blood pressure and high blood sugar. So this is something which they have been, I think it's well controlled. They're taking tablets. My dad has a high blood pressure and high blood sugar. My mom has high blood pressure.
Okay. So any allergies you have?
No.
And your blood group?
It's O positive.
Okay. And do you have any reservations for blood transfusion?
No, if it is required, I'm fine.
Okay. So Susie, may I know your weight to height ratio?
It is normal because the midwife was mentioning something like that when I went for the first visit.
Okay. And any history of having clots in the legs or lungs?
No.
Okay. So Susie, are you well supported at home?
Yes, my partner is very supportive.
Okay, that's good to hear. So, Susie, I want to ask you a few personal questions regarding your habits history. Is that okay?
Yeah, sure.
Okay. So, Susie, do you smoke
No.
or take alcohol?
No.
Okay. Or take any recreational drugs?
No, never.
Okay. And have you been feeling any down or depressed since last few weeks or months?
No, I was little worried with excessive vomiting, but now it is settled, so I'm happy.
Okay. Okay. Thank you so much, Susie. So I can gather from your history that you are pregnant for the first time, and you are having a family history of twin pregnancies, and also your mother suffers from high blood pressure, and also father suffers from high sugars, and you are your last grade date was 3 months back, and you not have any history of allergies or any, and your weight is normal. So is that okay, Susie? So can we move further?
Yes, doctor, please.
Okay. So, Susie, I have checked your name and your hospital number, and this report belongs to you, Susie. So, Susie, the report shows that you are having a twin pregnancy, uh, like having two babies, and the both the babies' heartbeat has is normal. And am I clear so far, Susie?
Yes, but doctor, is it like identical twins? What do I have? Because my sister had identical twins, and they're it's very nice to have a look at them. So, what sort of twins I have got?
So there are four types of twin pregnancies, Susie. So this you have a twin pregnancy where they share the same afterbirths. Okay, we call it as placenta in our medical language. So they share the same afterbirths, and they may or may not look same. So they can look identical or may not look identical. We call them the monochorionic diamniotic twins. So it will only come to know after the birth. Am I clear, Susie?
Yeah, that's fine. Yes.
Yeah. Susie, and the scan also shows that the twins are growing well, and as I can see from your last date of periods, which was around 3 months back, so the growth is matching. Okay, so the growth is adequate, and both the heartbeats are going on well. Okay, so can we discuss about the further management about your pregnancy?
Yes, because I have seen my sister struggling with a lot of things. So I am really looking forward for how can I make it easy for myself and my baby, and what problems for me and my baby can arise, and how I would be followed up and things like that.
Yes, definitely, Susie. I will be explaining. So, as we know that you are having a twin pregnancy, and as you can know that you are having a family history of having high blood pressure and sugars. So, there are twin pregnancy itself has some complications for the mother and the baby. Like the mother, they can have problems like developing of high blood pressure and proteins in the urine, which we call as preeclampsia, or developing high blood pressures in the pregnancy. So, or it can develop blood clots in the lungs and the wings, and also increase risk of having the cesarean section, that is operation, and also increase risk of having bleeding during the delivery. For the baby, there can be like increased chance of having the baby can grow small, or the baby can there can be one baby may have some problems with the development, or they may have like they can be born early than the time of the birth, which we call as preterm delivery, or sometimes there can be risk of separation of the afterbirths early, which we call as abruption. So for that, because of this many problems which can have in the twin pregnancy, so we usually suggest you to have a consultant-led care for follow-up and delivery, and a specialist team of doctors looking over your case. Am I clear so far, Susie?
Yeah, you are. I was wondering, like, anything can be done to prevent them. There are a lot of things which is little scary for me. So,
Yes.
is it possible to
Yes.
take any medications? Because I've been started on folic acid, nothing else.
So that is very good that you are started on folic acid, but we'll be also starting you on a medication called as a low dose aspirin, because from right now, because that will decrease the risk of having the high blood pressure and proteins in the urine. And also will be regularly checking, having your follow-up visits in the consultant-led unit. And at each OD visit, we'll be checking your blood pressure and also your proteins in the urine, and also will be monitoring your weight. And the further team, it will be by a specialist team of doctors consisting of my consultant and also the paying doctor, the specialist doctor for the babies, which we call as a fetal medicine doctor, and also the baby doctor, who will be there will be two baby doctors at the time of delivery, and also specialist midwife. Am I clear, Susie, so far?
Yes, and also, if I may ask, so this Down syndrome testing, how does that go for the babies? Because I'm sure it is little different for twins and the singleton, right?
Yes. So for twins, what we usually do is this scan, and what the is the fluid behind the baby's neck we check. So the more the fluid behind the baby's neck, there is increased chance of having the risk of Down syndrome. So we do this test along with the blood test, which we call as a biochemical screen, where we check two proteins, and depending upon both these results, the value comes as a low risk or a intermediate risk or a high risk. So depending, so both can be done in the twin pregnancy like a singleton, but the thing is that the accuracy is quite less than the singleton pregnancy.
Okay.
Okay. So further, what we can do is from now onwards, I will start you on the low dose aspirin also, and then we'll be calling you for the regular follow-up. And during 5th month, we will be having a baby malformation scan to see how the babies have been developed, both the babies. And after that, we'll be having a special sonography to look for the baby's heart. We call it as a fetal echocardiography. And then scans every 2 weekly, because as the twins are sharing the same afterwards, and to monitor for the baby's growth, both the baby's growth, and also to look how is the fluid developing, because the type of twins you are having, they can have some problems like having which we call as TTTS, where the one baby has more fluid around it and the other has less fluid, and there can be due to the problem at the level of blood vessels, which are specific to this type of twins. So that's why there will be more number of scans done in for you, Susie. Am I clear so far?
Yes.
Yeah. And also sometimes one of the baby may grow small, and for that's why we will be doing regular scans, and the mode of delivery will be decided by the specialist team of doctors and the consultant at around 35 to 36 weeks. And if it is uncomplicated, meaning that your blood pressures and sugars and hemoglobin stay normal, the baby's growth are fine, then around the consultant may think of delivering you around at 37 to 38 weeks.
Okay, so I can deliver normally, or will this be a cesarean section?
So yes, Susie, it's a good question. So if the twin one is the head down position, and provided there are no other complications, meaning your blood pressure stays normal and even the baby's growth is fine. If the twin one is head down, then we can consider you can deliver normally. And also if the space is adequate, then there is no contraindication to have a vaginal delivery. But if the twin one is not in a head down position, it is bottom down position, then you may require a cesarean.
Okay. So I think that would be decided in the coming days.
Yes.
Yeah. And do I get any leaflets or anything to read about, because this was a lot of information?
Susie, so I know I have given you a lot of information, so I will be providing you with the patient information leaflets to read about the multiple pregnancy and also some support groups, and then I will also make sure an appointment for you with my consultant next time, and also prescribe you the low dose aspirin and inform your GP. So and also give you the emergency contact numbers in case if you have excessive vomiting or if you are uncomfortable, you can come and contact us. Is that okay, Susie?
Yes, sure.
You want me to ask anything else?
No. Thank you.
Yeah. Thank you so much, Susie.
Thank you. Yes, Priya, I think we have overshooted the time. I didn't stop you. It was like 2 to 3 minutes. It's overshooted, but that's fine. Yeah, please go on with the explanations. I felt probably history, if you could have cut shorted, I think the time would have been enough.
Yeah.
And I really feel when you go for effect on mother and baby, if you could have combined those. Like, see, you will get high blood pressure, so we'll start with aspirin. So if you could do that, I think the time would have been saved. Otherwise, I think it was a good one.
Yes.
Yeah, please.
Yeah, so in history taking, in a case of twin pregnancy, it is very important to know when was her last date of periods, and also is it a spontaneous or an assisted reproductive technology twin pregnancy, because most of the ARTs can have a multiple pregnancy history, and also family history of multiple pregnancy knowing is very important. And as we know that they are also at high risk of developing diabetes and hypertension, so knowing that is also very important. And also are at increased risk of having hyperemesis gravidarum. So asking about the nausea and vomiting part is very important. Coming to the aneuploidy screening, so yes, the anti and biochemical markers can be done in the case of a monochorionic twin pregnancy, even dichorionic twin pregnancy, but the sensitivity and specificity is quite less than the singleton pregnancy. Especially for the dichorionic twin pregnancy, it is very less than the monochorionic. So because it calculates two separate twins, but it can be done. And coming to the other detailed history, so asking about after signposting, asking about the social history is very important, and their support history is also very important. And knowing the blood group and BMI and Jehovah's Witness, because they are at increased risk of APH, PPH, so that is knowing is very important. So yes, as we know that monochorionic twins are especially at increased risk of developing twin-to-twin transfusion syndrome, which is about almost 15% risk of having that in monochorionic twins, and also selective fetal growth restriction and twin reverse arterial perfusion is also there is risk, and also single IUD, meaning one pregnancy, one fetal demise also there is an increased risk, and hence they require every 2-weekly follow-up in monochorionic twin pregnancy and 4-weekly in case of a dichorionic twin pregnancy. So here in communication with colleagues part and a multidisciplinary team is very important, especially the consultant and the fetal medicine specialist for doing this specialized scans like the level 2 scan, and also the fetal echocardiography, and also the serial growth scans to measure the amniotic fluid, and also doing the fetal weights is very important. So that's why referring to the specialized multi-pregnancy clinic is important. And according to patient safety, asking allergies in every station is very important. Confirming the patient's identity and the hospital number before giving the before informing about the report is very important. And asking about the risks like blood group and any Jehovah's Witness, also any risk of PT risk assessment should be done in every patient.
Yes. Yeah, the main only one thing is, I think when we explain this monochorionic diamniotic, if you could see instead of the TTTS, you could just share that because it is like sharing the kitchen, right? So they might get an unequal food and they might grow very different. So if you could give that perspective, I think that was that's one thing which I wanted to add. Yeah.
Yeah. So the one twin may grow large and have more fluid around surrounding the twin, and there can be the other twin can grow small and there will be less fluid surrounding that twin. This is because they are sharing the afterbirth, the same afterbirth, but the thing is that there is unequal sharing of this afterbirth, and one twin receives more blood supply, and hence that twin grows more and the fluid around that twin is high. And the opposite is for the other twin, which has less share of that placenta, that is the placenta, and that's why the twin grows small and also has oligohydramnios.
Yes. So, and I think you very specifically mentioned about the timing of the delivery. So if it is, because that is something which people need to know. You can't comment whether when they would be delivering, but uncomplicated, yes, uncomplicated when they need to be telling as well. Yes.
So
and I'm sure if it is a structured discussion, they would ask a lot of things, but if it's patient simulated, things would be easier.
Yes. So if it is uncomplicated, around 37 to 38 weeks. it is and if they develop complications like TTTS, the guideline recommends delivery around 34 weeks, 34 to 36 weeks.
Yes, yes, Priya. I think that was wonderful. Thank you so much. And this is a very common station as well. Thank you so much. If you have any tips for them, you can go on.
Yeah, this is a common station which can come for the exam. So as it is a maternal medicine station, so yes, of course, 10 minutes will not be sufficient as in my case. So as Dr. Soumya said, taking a crisp history and answering the questions, answering the questions, like in case explaining the risk of preeclampsia, then telling at the same time, like I will be adding low dose aspirin, so that will save the time. And asking a proper specific detailed history is very important according to its station, like in case of twin pregnancy, any history of IVF pregnancy, or any family history of twins, any family history of high blood or personal history of high blood pressures or diabetes, knowing that is very important. And also the multidisciplinary team, the team members, and also the patient safety points, like knowing the allergies and also blood group and the Jehovah's Witness. And also explaining the complications to the patient, both the fetal and the maternal, and the further management plan is very important, and the timing of delivery.
Yes. Yes, Priya. So thank you. So hope this would help them to do better in the exams. Thank you, Priya. Thank you, guys. Don't forget to like, subscribe, and share as well. Thank you.
Thank you so much.
Thank you.